Namaste and welcome to the next episode of Clinical Ayurved by Dr. Mayuresh Agte. We were discussing Annosotus Vyadhi and we have discussed Malavaro Parikartika in last few episodes. Today we will discuss another Vyadhi which is very commonly seen in practice and which is really easy to handle also, and that is Krumi Rog. Now, symptoms of Krumi, all of you know: Jora, Tvak Vaivarnya, Gudagandu, Udarashul, Agdimandya, Tvak Vaivarnya, etc. And in case of Bhaya Krumi, there is itching of skin, rash. The symptoms are, all of you know. I will not go in details of them because it is very commonly seen symptoms. The treatment of Krumi Rog, which is given at the 3 steps, is Prakriti Vigar, Apakarshan and Nidan Parivarjan. In this case, all the 3 are important. The first is Nidana Parivarjan. Now, if you study the environment of any living object, it requires a suitable environment around that particular animal or living object to survive and to grow. For example, a fish requires water around so it can survive. For human, we require air around us so we can breathe and we can survive. So when we are thinking of Krumi and the suitable environment in our body on which they can survive and grow, what should we think of? Now, among the dosha, Vata is Amurta, so no question of any Krumi is surviving because of Vata or etc. Pitta itself is Tikshna Ushna, so Pitta dosh will, when they come in contact with the Pitta dosh, they will not survive. So what will be the suitable environment for the Krumi to grow is Kapha dosh. All the Guru, Snigdha, Drava, etc. guna of Kapha dosh are highly good to Krumi to grow, to survive in our body. So when a Nidan Parivarjan word comes as a treatment of in the Krumi, I will think of the Kapha dosh first, and Dhatu like Mamsa, Meda, which are or Dhatu which are Kaphashrayi are also important. Hence, when you say Nidan Parivarjan, always remember you have to go in the hetus of the patient in front of you and just see whether any Kaphakar Ahar Vihar is causing the problem. Because unless and until that Ahar Vihar, Kaphakar Ahar Vihar is continued, the problem will not be solved. So, firstly, always think of the Kapha dosh, and hence in the small children this problem is higher because there is a age of Kapha dosh, Balyavastha. So, when you are going to give treatment, remove the Kaphagara Ahar Vihar Hetu, first thing. Add Pathya of Ruksha Ushna Tishna like garlic, spices, etc., warm water as in Ahar. Then this is very important because unless and until you do this, the Krumi will not get cured completely. Thirdly, in the Vihar, sedentary lifestyle, now it is almost all of the people are working in the sitting, they have sitting jobs. So you have to add exercise for that to reduce the increasing kapha. So in all, Kaphakar Ahar Vihar should be out of the lifestyle and Kaphagna Ahar Vihar should be incorporated in the lifestyle. So simply giving Krumigna Dravya will not be enough. This factor is very important. Secondly, second line of treatment, which is Prakriti Vigat. It means to kill the krumi. Now, to kill the krumi, you have two set of guna. First is Ruksha Laghu, which is Kapagna, and Ushna Tishna is another set of guna. Now, when you are going to use Ushna Tishna Dravya, Ushna Tishna Ruksha, it will take care of krumi gna karma also, like Vidanga, Palasha, Eranda, etc. At the same time, they will reduce the kapha dosha also. So, in practice, in spite of using Tirtha Kashaya, Ruksha, Laghu Dravya, it will be better to use Katu Katu Ushna, Laghu, Ruksha, Tishna Dravya, because they will take care of both the things, to reduce the kapha dosh as well as to kill the krumi. So, Vidanga, Palasha, Chitrak are very useful drug. All of you know, I will not go in detail. Third is Apakarshan, to remove the krumi out of the body, and hence here they have stated for that Bhamana Nasya for Shiroviration, then with normal viration, whatever good for the patient you can decide. But generally, which is very easy to use in practice, is viration. Viration means I am not talking about the Panchadharma viration like Snehapan, etc. Viration with Ishna Ushna Dravya like Snohi, Nishotar, Ayurvedic, Eranda Sneha, which will kill the krumi as well as will have a viration or purgative action, will be helpful. Nowadays, lifestyle has been changed. You know, junk food or food habits are also very varied. Sedentary job is a part of the life, and hence, in practice, I suggest the patient to, in spite of they or even drinking of bore water or not pure water, because some marketing people take the water whatever they get at that place. So all these food habits, impure water, sedentary lifestyle, generally I ask the patient, even if they don't have any krumi lakshana, to take kruvigna dravya or kruvigna chikitsa after 3 months or at least after 6 months. When a patient comes to you with recurrent gastric or Anna-Sodas problem, whatever it is, Udarashul, Ajirana, Agnimandya, whatever it is, Atisar, with you take the case, you give the treatment to the symptoms what the patient is having. But in my practice, in addition, I always add at least one krumigna kalpa or krumigna dravya, because of the lifestyle of the food habits, change food habits, sitting jobs, and all these contribute to the growth of the krumi in the intestines. So, Anna-Sodas Vyadhi, now it is very easy to tackle, but you should keep in mind that in case of Anna-Sodas Vyadhi, in today's era, Krumigna Chikitsa has got a good importance, because either they will produce symptoms in the body of their own, or because of their presence, symptoms of other diseases of Anna-Sodas Vyadhi may get increased. So, think of it, keep in mind that you have to give antiviral treatment to the patient, or have you to consult the patient that you should take this antiviral treatment frequently to keep your digestive system in good condition. Next lecture we will come with the another very. Thank you very much.